So hello everyone, I hope you're having a good night. We will continue our series on Science Night COVID special. You might remember if you were here the last times, first time that we did this, in the beginning of April, we talked about COVID-19, the disease, and how it kind of occurs in people and how it's spread, how we can classify it. Last week we talked a little bit about how we actually get infected with coronavirus and how our body responds to this infection. And today we're going to talk about another topic, which is kind of like problems that people have before they get COVID-19 and can create more complications that are not solely the infection of the SARS-CoV-2. So today, I'm very happy to introduce to you Tim Hollstein. So he's a medical doctor in the UKSA. He works in internal medicine and in the department of endocrinology.
Yeah, the hormone department.
The hormone department. And he's going to talk a bit about diabetes and how this disease can be not only kind of a complication once people get infected, but also how it can actually be a disease that is induced by coronavirus, potentially. So
exactly.
A case study that they had here in Kiel. So thank you everybody for tuning in, and without further ado, I will hope that you can start your presentation, maybe introduce yourself first, and then we go from there.
Yes, so hello everybody, my name is Tim Hollstein. I'm, as you already introduced myself, a physician working at the University Hospital here in Kiel. And today I want to talk about COVID-19 as a risk factor for diabetes. And I'm not sure if everybody can see my presentation now, but it should work. So that's great. Okay. So as you might have heard, the SARS-CoV-2 infection, which is present since almost 1 year, is a pneumonia that can lead to an acute respiratory distress syndrome. So the virus, the SARS-CoV-2 virus, mostly damages the lungs, and that can kill people. And we have 140 million cases up to date and 3 million deaths also worldwide. But interestingly, 80% of the infections remain asymptomatic, but still, even if people are asymptomatic, they can still have side effects or complications due to the infection. And here you can see on the right lower graph, you can see that we are in mid of the so-called third wave. And this is why we still have to keep distance here and have to follow the COVID rules here in Germany. Okay, COVID-19 can have a good or a bad outcome, and mostly when it has a bad outcome, there are some risk factors involved that can actually lead to a worse course of the disease. And these risk factors are obesity, hypertension, lung disease or heart disease, asthma, also autoimmune diseases, but very important, diabetes is another risk factor, and this is what I want to talk about today. So for people who don't know what diabetes is, I'm gonna give you a little introduction on this. So normally when you eat something, your body digests the food and absorbs the glucose, so the blood sugar or the sugar, into your blood. And then this blood sugar needs to enter the cells so that it can be like converted to energy. And in a healthy state, your pancreas, so this is the organ here on the, which you can see here as in a yellow color, the pancreas produces insulin, which then acts like a key to open the door for the glucose to enter the cell, and so that the cell can use it to produce energy. When you have diabetes, this does not work anymore. And we distinguish between two different types of diabetes. There's type 1 diabetes and type 2 diabetes. And I will use my PowerPoint pointer to show you. So here type 1 diabetes. When you have this disease, which mostly affects young people, your pancreas cannot produce insulin anymore. So there's some production issue. And this means that the glucose in your blood cannot enter your body cells anymore. And so your body cells are beginning to starve. And also your blood is full of glucose, which has or leads to a lot of complications. For example, when your blood is full of glucose, your kidneys, they cannot filter the glucose anymore, so you pee it out a lot. And because glucose attracts a lot of water, you lose a lot of water by urination, which makes you very thirsty. And also you lose a lot of weight because you lose so much water. So this is type 1 diabetes. If you don't treat this, it can lead to death very quickly. And then we have type 2 diabetes, which is much more common in our societies. And there we don't have a production issue. The pancreas can produce insulin, but there is so much sugar in the blood because of our bad nutrition, which occurs in our Western societies, that the cells are going to say, stop, I don't want so much sugar anymore. And so the insulin, which docks onto the insulin receptor, is not so efficient anymore in letting in the glucose into the cells. So it cannot open the door so much. So the key is not working so well anymore because the cells are transforming their receptor so that they become resistant to insulin. And so this type 2 diabetes, we call it also insulin resistant diabetes. So we still have insulin, but it's not working so well anymore. And mostly when we talk about COVID-19 and diabetes as a risk factor, we mostly talk about this type 2 diabetes because those people also have other complications, which I will show you. When we look deeper in the pancreas, here you see a bit where it's located. So everybody can kind of follow where we have this organ. Here is when I show with my pointer here a bit above the pancreas, here would be the stomach, and then here is the duodenum, which is the start of the gut. And the little green thing here is the gallbladder. And so when you eat something, the pancreas not only secretes insulin, but it also secretes enzymes to digest the food and, for example, to break up the fat in your nutrition. So this is why the pancreas is located so close to the gut. And inside the pancreas, when we look onto the microscopic level, we see that there are different structures. And these yellow structures here around this purple structure, they are producing these enzymes to break down fats and digest the food. But then there are also these purple structures, and we call them islets, so like little islands in the pancreatic structure. And these islets are full of beta cells. And the beta cells are important because these are the cells that are producing insulin. So the pancreas produces insulin in these beta cells. And this is important for the body to get the energy it needs. So when we go back to COVID, we know that the coronavirus enters the cells via another receptor, which is called the ACE2 receptor. I don't want to talk too much about it, but this is the main receptor. And when we look in an expression profile where these receptors, in which organs these receptors are expressed, we can actually see that they're mostly expressed in the colon, but they're also expressed in the lung. They're like kind of expressed everywhere in the body and also in the pancreas. So they are expressed where the insulin-producing cells are situated. When we look at some studies, we see that people with diabetes are really at higher risk for a worse outcome of COVID. So, for example, here's one study that studied over 7,000 patients with or without diabetes who experienced the COVID infection. And we can see here, if you look at this graph, that when your blood sugar was not controlled or when you had diabetes, your survival rate was much lower compared to the case when your blood sugar was well controlled. So diabetes increased the risk for mortality and also diabetes increased the risk for medical intervention. So interestingly, we know that the predecessor of SARS-CoV-2, which is SARS-CoV-1, also showed similar findings. And also MERS-CoV, another coronavirus, was associated with worse outcomes in diabetic patients. And here is another study where we can see this also very well. So here you see also the survival rates of an infection. And here you see like 3 different lines on the left graph, for example. The green line are people with normal blood sugar, and the purple line are people with high blood sugar but who don't or who didn't have diabetes before. And the red line are people with diabetes. And you can see that those people with diabetes and high blood sugar, they have a lower survival rate. So why people with diabetes have these complications? So why they are at higher risks? So first of all, when we talk about people with diabetes, we mostly talk about people with type 2 diabetes. And I already told you this is mostly a diabetes which is due to bad nutrition and also probably physical inactivity, so that your body is overloaded with energy and with sugar which it cannot use, and so diabetes develops as a consequence of that. And so these people are also mostly obese, and they have we call this low-grade chronic inflammation, because when there is too much sugar in your blood, then also your body responds with an inflammation. And also when you are obese, or when you have too much, especially too much fat around your organs in your belly, then your body also responds with an inflammation. So people also have this, and they have mostly also coagulation issues. They have higher blood sugar per se, and they are older. They also have hypertension, so high blood pressure, and probably also a renal disease. So people with diabetes have mostly other conditions, other comorbidities, which are leading to a poor outcome. So it's not the diabetes per se, but it's a combination of all factors. But still, the coronavirus can even have another impact on these people with diabetes, because in people with diabetes, the function of the pancreas is already impaired, especially also type 2 diabetes, when the pancreas is trying to secrete so much insulin that it can that these cells that are becoming resistant to insulin can still take up some glucose. So the pancreas is really overproducing insulin in these people with type 2 diabetes, and it's kind of already impaired when they getting the disease. And then the coronavirus probably still worsens the pancreatic function and can lead to a worse outcome in these people with diabetes. And another thing is that in people with diabetes, there is a higher risk for this so-called cytokine storm. Probably you've heard about this word. That means that your immune system is overreacting against the coronavirus and inducing a response which is also damaging your organs of the body. And we know that this risk for the cytokine storm is higher in patients with diabetes. But we want to look especially at this point. So how does the coronavirus damage the pancreas even more in people with diabetes and also in healthy people?
Can I ask one question?
Yes.
So that increase, so the cytokine storm, is it also due to the already inflammation being present in these patients?
Yes.
And then it's completely out of control so it just reached this point that it cannot be controlled anymore?
We don't know exactly why diabetics have a higher risk of the cytokine storm, but as you said, we believe that this low-grade chronic inflammation people have is already kind of a triggering point for the immune system to even overreact to this infection.
Maybe makes the body less sensitive to the message of saying stop, because it's already always there.
Yeah, exactly. And the immune system is kind of in an alarm position. Yeah.
Okay, thanks.
So if we look now at this slide, here again, we want to know how does the coronavirus actually affect the insulin production and the pancreatic function. And there are 2 ways how it can affect it. So there's a direct way, so it can directly destroy the cells. And there is an indirect way. It can lead to the production of autoantibodies, which can then destroy the cells. This indirect way is common with other infectious diseases. We know that some viral diseases can induce diabetes, especially type 1 diabetes, by inducing an autoantibody response. So the virus, not the coronavirus in this case, but another virus, leads to the production of antibodies that are coincidentally also attacking the pancreas and then attacking the insulin-producing beta cells, so they don't produce insulin anymore, and the patient develops diabetes. We know some viruses that are doing this, but we don't know how does the coronavirus damage the beta cells that are producing insulin. Is this way or is it this way? So there's some evidence from actually 10 years ago from the SARS-CoV-1, so from the predecessor of the coronavirus, SARS-CoV-2. We know from histological studies, so from microscopic studies, for example this one here, that the SARS-CoV-1 virus damages directly the islet cells and the beta cells and causes acute diabetes. And so we can suspect that this might be also the case here with the coronavirus 2, SARS-CoV-2. And interestingly, we found a little bit of evidence for this case. Last year, when I started working here at the university hospital, I visited a patient who developed diabetes. And this was a very young patient, 19 years old. And he told me that in the beginning of April 2020, he started to feel very tired, and very important for the diagnosis of diabetes, he became very thirsty and he had to pee a lot. So these are symptoms that are very important for doctors. And then also at a later time point, he started to lose excessive weight. So these are all symptoms that can point towards a diabetes diagnosis. So with these symptoms, he presented in our emergency ward 1 month later. And we did some diagnostics, some blood tests, and we found that his blood sugar was super high. Like normally you have a blood sugar around 70 milligram per deciliter, but here he had a blood sugar of 550 milligram per deciliter. And also we found other markers that were associated with diabetes. And so we diagnosed diabetes mellitus in this patient. And then we wanted to find out, where does it come from? So we did the typical autoantibody test, because normally people who develop diabetes mellitus type 1, they should have autoantibodies. It could be due to an infection with a virus, but it could also be genetically, for example. And here we could not find any antibodies. So this patient was completely autoantibody negative. So this could not be the reason. We also scanned his genetics, and we didn't find a high risk for a diabetes infection in this patient. We also scanned his family, and we found that one of his cousins had this autoantibody positive type 1 diabetes, but it was a cousin, it was not a direct relative. And his grandmother had type 2 diabetes, but which is not associated with this case. So we were asking ourselves, what could it be? And interestingly, when we further asked the patient, he told us that his parents actually had a coronavirus infection. Because in March, they were in Austria, and as you know, Austria was a corona hotspot during this time. And they were skiing there, and when they returned from skiing, they experienced the first coronavirus symptoms. And the child itself, so the patient, he didn't experience any coronavirus symptoms, so no smelling problems, no feeling of being sick. But still, he was getting tested because his parents suspected that he could also have been infected because they are all living together in one house. So he got an antibody test in the end of April. And there actually it turned out that he got an infection. He was positive for the coronavirus IgG antibody and negative for the IgM antibody. And this already tells us that his infection is some weeks or occurred some weeks before the test, because normally when you have an acute infection or an infection with the coronavirus that just passed, your IgM antibody is also positive. But in this case, the IgG is only positive and the IgM is not. So we could suspect that the infection occurred around, here we kind of plotted the weeks here, week -7 to week -5. And this is kind of a likely infection period where our patient was infected with the coronavirus. And we suspect, due to this whole history and the negative autoantibodies, we suspect that also, although he was asymptomatic, so one of the many patients who were asymptomatic, we suspect that the coronavirus still infected the pancreas and destroyed his beta cells, so that he then developed the diabetes mellitus. And our idea, which we published in a journal, is actually strengthened by other studies. So, for example, in China, also in a big cohort of 450 patients, 95 were identified with new onset diabetes, and this is type 1 diabetes mellitus. And they were also at greater mortality risk than those with hyperglycemia or diabetes. And in another study from the UK, similar findings were reported. In children, there was an estimated 80% increase in new onset type 1 diabetes. But this was a small study, so you have to be cautious when interpreting the results. But still, we were not the only one who reported this increase in diabetes mellitus, or at least who reported like a case report of a patient. So, as a follow-up, other work groups and other researchers were doing studies to really find robust evidence that the coronavirus can actually infect the beta cells and destroy them, because it was still kind of a hypothesis we had. We could not provide direct evidence because we could not take out the pancreas of our patient. This would be unethical, so we still had to kind of suppose it that this was the case. But other researchers, they actually looked at beta cells from infected patients and at these islets from infected patients. And for example, in this study, you can see this. Here you see human pancreatic islands, and these are stained in red, and you can see that the ACE2 receptor, so the entry receptor for the coronavirus, is expressed in these islets. So this actually adds high probability that the coronavirus can also infect these cells. And they did this. So they infected the cells with the coronavirus, and they could see that the coronavirus can replicate in these cells. And when you look here in this image below, you can actually see the coronavirus in these little blue arrows. You can see the little coronavirus is in the beta cells of a pancreas. And then, which is also very important, they showed that when the coronavirus infects these beta cells, the cells are producing less insulin. And this makes sense because when the cells are destroyed or are not working properly anymore, they don't produce so much insulin, and this could have direct consequences for the patients. And as a last step, they also looked at patients who deceased from the coronavirus. And then they could really do some histological analysis. So they took the pancreas of the patient, and then they looked at the pancreas and tried to find the coronavirus inside. And what they found is that the coronavirus was actually present in the cells that are producing insulin. And you can see this here. For example, the cells that are producing insulin are stained in brown, and the coronavirus was inside these cells. And so they provided direct evidence that the coronavirus has a direct cytotoxic effect, this is how we call it, on the beta cells, so that it can destroy it. And they described it like this, that the beta cells might lose their identity upon the coronavirus infection, which then leads to less insulin production. But as always in research, not every study did find these results. There was another study that was published in a well-known journal, and they found that the coronavirus can actually infect pancreatic cells, but they didn't find evidence that the coronavirus can infect the beta cells that are producing insulin. So there are still some conflicting evidence, but as far as we know, there is a high probability that the coronavirus can actually destroy insulin-producing cells. So when we go back to our image here, we think that this effect of the coronavirus on the pancreas is mediated by a direct destroying capability of the coronavirus. So it might directly destroy the cells that are producing insulin, the beta cells. So as a take-home message, SARS-CoV-2 seems to destroy the insulin-producing cells, and this puts people with diabetes at higher risk because they already have a pancreas that has an impaired function. And if then the coronavirus gets on top of it and even destroys more pancreatic tissue, and especially tissue that is producing insulin, it might lead to worse outcomes because the blood sugar gets out of control, and we know that this is always associated with worse outcomes during an infection. And in some cases, like we reported it in our case study, it might even cause new onset diabetes mellitus. So we have to be aware of that, and I think more research is needed because diabetes mellitus is also important disease, and you have to control it very well to maintain a good lifestyle. And there are some questions which we still have to find out, like when the diabetes is caused, is it permanent or does it go back after the infection? So we are also monitoring our patient, for example, and we see that he is needing less and less insulin for now compared to the infection period last year. So he appears to be able to reduce his insulin. So we think that his pancreas is actually recovering. So this is another study which we have to do. We have to follow up these patients who developed type 1 diabetes during the infection. And we also have to find out who is at highest risk to get a new onset diabetes and what's the probability in general to develop this disease during the infection. Okay, so this was my little talk about diabetes and the coronavirus. I hope I was not too long or over exaggerating the time.
No, there was like perfect timing.
Okay, then I'm open for questions.
Yeah, so if you have any questions, you can ask them in the chat or, I don't know, send me a message. I have a million questions though. So it's really, I find it, my first question was, how is the patient doing? But you said like maybe this could be reversed, because I was wondering if it's a virus that is destroying the beta cells, which some papers indicate, can the beta cells be reconstructed? Like
normally not, but it might be that the beta cells are not completely destroyed. Mm-hmm. So it might be that the virus is kind of damaging them, but that they can recover after the infection. We actually saw this with the SARS-CoV-1 virus. Mm-hmm. So people developed diabetes during the infection, but it recovered after the infection. Okay. And in this case, it did not fully recover in our patient, but still we could call it a partial recovery, because now he's he needs only half of the insulin he needed 1 year ago. Mm-hmm. And so this is an observation that is not normal with people who are developing or who develop type 1 diabetes mellitus, or the normal type 1 diabetes, which is due to autoantibodies, for example. Yeah. They actually would need more and more or a stable dose of insulin, and they wouldn't recover.
Yeah. So it's like beta islands make beta islands. So if you destroy them completely, you probably cannot make more, but...
Yeah, exactly.
Okay. Yeah. So, I have another question, it's just on top of my head, if I forget. Okay, we have a question in the chat. I will remember later. So, Nea Mishra says, great talk, very fascinating finding. The question that she has is, in the studies that analyzed many COVID-19 patients, did they see any effect of disease severity with the onset of diabetes?
Yes, so when people had new onset diabetes mellitus, they had a higher risk of mortality.
Oh.
Even a higher risk compared to people who already had diabetes, or people who had a bad blood glucose during the infection. So when you really have a new onset diabetes during the infection, you normally also have a worse outcome. And this was not the case in our patient. He had an asymptomatic infection, so it would be unusual in this case. But he was very young, and probably, there can also be exceptions to the rule, I think. But generally, we would associate it with worse outcome.
Okay. So when do people get normally diagnosed with type 1 diabetes? Is 19 years old quite late? Is it early?
No, it fits typically the typical diagnostic age of people with type 1 diabetes. People with type 1 diabetes are normally very young. They can develop this disease from very early, like age of 3-4 years, normally to the age of 25. And this is the normal period where people can get this disease. We cannot completely rule out that our patient also developed some kind of type 1 diabetes, which is autoantibody negative. There are some types of diabetes that are autoantibody negative and that are not caused by a virus. So we cannot rule out this because we didn't look at his pancreas because he's still living. We cannot take it out.
Well, that's good.
Yeah, but the infection or the time where the infection occurred and the time where the diabetes occurred kind of put us to this hypothesis that the COVID might be the reason for his infection, even if we cannot rule it out completely. But he definitely does not have a type 1 diabetes, a traditional one with autoantibodies.
Okay.
Yeah.
So there could be a chance that he just gets better over time.
Yeah, exactly. There could even be a chance that he completely recovers from diabetes.
Okay, that's good.
We will definitely follow him up. Now he's going to Berlin to start to work in the Adlon, in the nice hotel next to the Brandenburg Gate.
Okay.
So he has a lot of patient contact, not patient contact, but tourist contact. Yeah. So we're gonna stay in contact with him as well.
Okay. Tell him also to not get in contact with many people. We still.
Yeah. He actually also got vaccinated by us just now.
Very good.
Yeah.
I had another question. So what about falling, kind of going through long-term effects of COVID? Because I read today that people with diabetes also show kind of increased likelihood of even like 6 months after having the disease that can lead to hospitalization and so on, they show problems in their kidneys. So there's so they're more likely to have problems there.
Yeah, exactly. People with diabetes, and I think in this case we mostly talk about people with diabetes type 2, so the insulin-resistant type of diabetes, which is caused by bad nutrition habits and physical inactivity, so the overload of the body with energy, basically, which also is associated with all these other comorbidities, so obesity, as I told you, hypertension. And in this case, when there's too much sugar in your blood, which is still the case in these people with type 2 diabetes in most cases, this also damages your kidneys. And as far as I know, the ACE2 receptor is also expressed in the kidneys. So this can also be like an on-top effect of the coronavirus, that the kidney that is already damaged by the high blood sugar is then further damaged by the virus itself.
Yeah.
So this would be an explanation for the higher risk of kidney condition in these patients.
Yeah, that is interesting.
Mm.
Okay. Any more questions? You can write them in the chat. Any questions in the room today? Are you sure? Okay. Then I think do you have any questions for yourself?
For myself?
Yeah,
No,
something
I'm
that
quite
you're quite fine? Okay.
I'm happy.
Yeah, that's very good. So I just wanted to thank you for coming and showing your great results, and also kind of giving us a little bit of good news, saying that this patient is doing better and fine. So I think that's also quite important. And I also want to talk to the people at home that next week will be our last science night. So for COVID-19, Dr. Neha Mishra, also the person that is asking questions in the chat, is going to be the one giving the presentation. And we're going to talk a little bit of already kind of said. We're going to talk about the long-term effects of COVID-19 and also what we are going to be doing here in Kiel in terms of researching the long-term effects of COVID-19 as a disease. So it's a lot of thinking about the future, thinking about maybe better times where we do not have a third wave and can go outside and have a little drink. So I hope you guys come next week. And yeah, I also wanted to say before that all of these presentations, so the past presentations as well, are now in kind of the YouTube of ANZA 48. And once we finish the whole talk, so next week, they will be publicly available, so you can also like share the link and kind of revisit what we have talked here. So thank you very much, and thank you very much to the crew. You guys are great. And yeah, have a good night, everyone. Ciao.